Morning Drive.
Thank you, Stephanie. And we are following breaking news this morning. Moving the needle in the COVID-19 pandemic. The country is rolling out Pfizer's COVID-19 vaccines for some of the smallest Americans.
If we have safe and effective vaccines, why wouldn't we make those available to families to make that decision and protect their children?
New video into the newsroom overnight shows the first shots being administered at Hartford HealthCare in Connecticut to this age group. A group of young kids waited patiently for their turn, becoming part of this new phase of the pandemic. And this morning, we're hearing from the CDC director. Dr. Rochelle Walensky says that we have taken another important step forward in our nation's fight against the virus that causes COVID-19. President Biden is echoing the importance of this moment, calling it a turning point.
The government says about 28 million children 5 to 11 years old are now eligible to get vaccinated. We have team coverage. Aaliyah Hodges is live with the concerns of parents and the doctors who say the pros outweigh the cons. We start with Lake and McGee and the preparations happening now at local clinics and pharmacies so they can start giving the shots. Lake, and you're at Dr. Aziz Pharmacy, Northeast Side. Where do things stand there?
Yeah, so they actually were going to get their children's Pfizer vaccines starting last night. That's when they were planning on receiving it. Now, staff here do tell me that they're expecting around 400 doses. Now, I know that seems like a low number, but the vice president of clinical services here tells me that that is a good rollout number for now because they're not sure how many parents will actually sign their children up to get vaccinated. Now, this vaccine, it's pretty similar to the one that the 12 and older could receive.
This is a two-shot series, so 21 days apart, so they'd get their initial vaccination, and then 21 days later they'd get their second, just like the adults have.
Here's the difference between the vaccine for ages 5 to 11 and 12 and up. For adults, the vaccine has to be stored in an ultra freezer. For ages 5 to 11, it can be put in a regular refrigerator. And the dosage is a third of the adult dose. Now, here at Dr. Aziz Pharmacy, they do offer walk-in clinics to get the vaccine, but they do suggest you go on their website, check out and see what times they have available. That'll just make it a little bit easier for you and for the pharmacy here to get you vaccinated. Reporting live at Dr. Aziz Pharmacy, I'm Lakin McGee for Wish TV, wishtv.com, and follow us on Facebook.
Thank you, Lakin. And health experts, as they encourage the shot, some parents are having a hard time deciding whether to go forward with it. The Fishers Health Department will administer the shots beginning tomorrow, and that's where we find News 8's Aaliyah Hodges with more on this. So, Aaliyah, if parents are on board, they can make an appointment.
Yeah, Kylie, so appointments are preferred at this time here at the Fishers Health Department. And while there are some parents that are racing to get their elementary kid in line to get that shot in the arm, there are some other parents who have some questions and might be a little hesitant at this time. According to the Kaiser Family Foundation, they have their latest poll out, and it says some parents are, again, they're just hesitant. Some of the biggest questions are whether COVID-19 vaccines can negatively affect fertility and puberty in children and possible long-term side effects. This morning, health experts are hoping to ease those fears.
Whatever side effects we see really have to be compared against the risks of not getting the vaccine. More than 8,300 children in this age group have been hospitalized due to COVID-19. A third of them ended up in the ICU.
The American Academy of Pediatrics says there is no evidence that the vaccine can lead to loss of fertility, and side effects are temporarily and mostly mild or moderate. Members of the American Academy of Pediatrics, the Pediatrics Infectious Diseases Society, and the National Association of Pediatric Nurse Practitioners, they are speaking out in favor of the vaccine for children. For now, reporting live in Fishers, I'm Aaliyah Hodges for Wish TV, wishtv.com, and follow us on Facebook.